wanted to welcome everyone to our webinar, Mastering Wellness Campaigns with HouseCalls Pro for Epic. My name is Tabitha Jung. I'm the Senior Product Manager for Entrado Healthcare, and we're happy to present this webinar to you today to hopefully provide you with some thoughts around mastering wellness campaigns for your organization. We also have two other speakers who will be providing information to you guys. Barry Crocker, he's also a product manager for our team, as well as Starla Joyner, and she is one of our Entrado Epic BFFs that you guys likely have worked with in the past and will continue to work with to be able to provide expertise about your Epic solution and our Entrado HouseCalls Pro solution. So today, like I said, we're going to be talking about wellness and prevention and the different campaign options that you guys can think about when you're considering setting up workflows with HouseCalls Pro. Being the time of year, and as you guys can probably tell, I am myself a little sick, but we want to talk about the flu season and how, we'll likely have a stronger flu season this year because of a decrease in natural immunity. So we chose that specific example to highlight in this webinar to be able to provide the benefits of what HouseCalls Pro can do for you and the automated steps that we can control and make it easier for your organization to continue with your day-to-day. So I'm going to go ahead and hand it off to Starla, and she's going to talk about wellness and prevention.
Thank you, everybody. I'm Starla. And so as we all know in healthcare, wellness and prevention is extremely important. So as of right now, there's a thought that we may be facing a more severe flu season this year because we didn't have as much flu last year due to COVID. So there is actually a less natural immunity in the population. So right now, we have more vulnerable people in our communities that are needing flu shots. So on the right are some of the solutions and the quality metrics that our HouseCalls Pro solution supports with your EMR.
Hey everybody, my name is Barry Crocker. As Tabitha mentioned, I'm a product manager here for HouseCalls Pro. And I'm going to walk you through first what it looks like to set up a wellness campaign with Entrado and HouseCalls Pro. And then we're going to walk through a few examples of what those campaigns actually look like from the patient's perspective. So starting on the slide here, how to achieve successful wellness campaigns. So we've built a system here that makes it really easy to acquire the data that you need from your EHR and create those patient lists, to target the various different types of wellness campaigns that you're probably already running. And we've tried to make it as simple as possible. As you can see, the top row, the health organization row, there's only two items there. So the first item, of course, is staff pulling the data. So this is kind of the most important part of this entire process, right? Because with accurate data, we can really achieve a lot through, connecting your EHR with HouseCalls Pro and automating these wellness campaigns across the board. So, something that I find myself talking a lot about, I know Starla spends a lot of time talking about, is having good data in the system. If we have good data in the system from the start, then that really opens the door to a lot of opportunities to not only successfully launch these wellness campaigns, but even further downstream, right, with just standard patient reminders, referrals, things like that. So first step would be gathering your data, a patient list of who needs to be reached out to for these campaigns. Once that data has been pulled and delivered to HouseCalls Pro, we're going to start our process from that point on. So we're going to deliver the campaign message to the patients with whatever modality is chosen. And from there, the patients are going to start to receive those messages. And many of them, hopefully, are going to go on from there and schedule an appointment. So that takes us over to the second column. Once a patient has been scheduled for a flu vaccination appointment, we want to make that process as simple for them as possible once they arrive at your location to actually get the flu shot in this case. So we have a system built in where the client can arrive in your parking lot, and they can send a message into the clinic saying that I'm here. And then they can receive, instructions from there, from inside the clinic. They may say, we're not quite ready for you. Please wait in your car. We'll let you know when we're ready for you to come in. And that just increases, patient safety across the board, right? Let's keep people away from each other as much as possible, especially with COVID and everything. But even just in general, right? Flu season can be a very dangerous time for certain people. So we're going to leave them in their car, and then whenever the clinic is ready for them, they can notify that patient, we're ready for you to go ahead and come on in. So the patient comes inside, and they attend their appointment, get their flu shot, and go home. And then we get into the post-appointment section, where we can automate a message after the client has received their shot and they've had a little time to adjust to it. We can send them a message and ask them how they're doing. Are you having any symptoms, anything hurt, any fever, et cetera? And then the patient can reply back there and either say, nope, everything's great, or, in some cases they may say, I've got a slight fever, or my arm's a little sore. And then based on that feedback, the clinic can make a determination then if they want to schedule a follow-up appointment for this patient, or if, just maybe provide them some instructions to wait it out, maybe take a Tylenol and, see if that affects the fever. But you've got a lot of options from that point to, go ahead and follow up with the client there. So, and if needed, you can even schedule an appointment right there for them to come back in and get checked out. So that's kind of the workflow here at a high level. And so let's move forward, and I'm going to introduce you to Elizabeth. Elizabeth is a patient of Modern Clinic and keeps up to date with her preventative wellness visits. Liz is retired, but does work part-time at a local florist shop. So she does have, some exposure to things like the flu and stuff in her daily life. She also has a large family of 3 children and 7 grandchildren. So it's very important that she's protected from the flu in case someone in her family catches it and exposes it to her, which is generally how a lot of us seem to catch things these days, especially if we have kids going out to school and things like that. Liz does get her flu vaccine every year, but she doesn't often know when they are available. So back to data collection. Epic has a very robust data repository, and as long as that data in the system is accurate, then it's relatively easy to pull out a list of patients that will fit the criteria. So again, in this case, we're talking flu shots. So we would want to pull a list of patients that meet the criteria listed here: over 65 in age, has an assigned primary care provider, and has had an appointment with the primary care provider in the last 365 days. From there, it becomes a workbench extract from Epic. So choose a template, edit your report criteria, and then we're going to, you're going to export that information and deliver it to the HouseCalls Pro system and to kick off that campaign. So again, this is something that Epic is really good about helping their clients with. So, if this workbench extract, if this data collection is something that is not, is a bit foreign to you, or maybe, you don't have a strong staff there to be able to kind of get into these sort of data collection efforts, reach out to your Epic TS. They're really good about this stuff. They have a lot of really good documentation. We have a lot of knowledge on these things as well. So, as part of the deployment process with Intrado and HouseCalls Pro, we're happy to help you through these things as much as we can. But do keep in mind, utilize that Epic TS. They're there to help, and they're very good at what they do. So let's look at what this campaign is actually going to look like to Liz as she works her way through the process. So the clinic, finds out, hey, we've got flu shots available, right? So they go in, They pull a list out of Epic of all of their eligible flu shot patients, and they start to send these messages out. And this is what it looks like for Liz when it comes through on her phone. So very basic message: Liz, flu shots are available at our facility. Reply 1 to schedule or 2 to decline. Now there's a couple of different ways that we can handle the scheduling portion of this process. Our internal data tells us that patients are 37% more likely to respond to a text message than they are to a phone call. You know, over the years, people have become numb to their cell phone ringing. So we generally get a lot more involvement starting with a text message. So now we can start with a text message, and then we can transfer that to a phone call later on if you know, we feel like that would be a better way to get this patient involvement. The sort of older that your pool of patients is, it may be more difficult to get them to interact with, you know, long back and forth text message conversations. We don't want to make it overbearing for the patient. We want to make it as easy as possible. So we have 3 different options here. First one is SMS scheduling. And you can see that we're actually scheduling the appointment right here via text message. So it starts as an SMS and it remains an SMS conversation through to the end. So as you can see, Liz replied 1, and we replied back what day works best. And Liz said next Wednesday, which we're able to work with, you know, various methods of them telling us what day they want. So if they give us a specific date, we can handle that. As you can see here, next Wednesday, the system recognizes that. And then our system is going to go in and work with your EHR to find out what appointments are available and present those back to the patient. So Liz has been presented with 3 appointment options here, and she chose 1 for 9:45 a.m., and that's it. The appointment is scheduled. So we reply back with a confirmation. Your appointment has been scheduled, and any instructions that we want to apply there. We can also redirect the patient to schedule their appointment in MyChart. So it can be as simple as one message out to the patient here: flu shots are available at our facility. Would you like to schedule? If so, click this link, go into MyChart. You can choose from, you know, available days and times to make that appointment there. The third is a combination of SMS and a phone call. So we start with an SMS message to the client. We tell them the flu shots are available. And we ask them, you know, when they have a few minutes to speak to an associate, press 1 to schedule. So Liz presses 1, and we inform her, thanks, we're now going to call you and connect you with an associate. So what our system actually does at that point is it makes 2 phone calls, 1 to the patient and 1 to the clinic, and then merges those 2 calls. So we're basically creating that connection between the client and the clinic, or the patient and the clinic, for them to go through and schedule that call. The safe arrival piece. So this is what I was talking about earlier, where we can trigger the message. And this is a day of a message. So the morning of the appointment, Liz is going to receive this text that says, hey, reminder, you've got an appointment today at 9:45. Upon arriving at our office, please reply arrived. So Liz knows when she gets there, she needs to just stay in her car, send the text into the office, and they're going to let her know what to do from there. So she does. She shows up. She says, I've arrived. And then the clinic says, okay, please remain in your vehicle. Wait for further instruction. And then a few minutes later, she receives a text, we are ready for you. Please come inside and check in with our receptionist. Now, this is the follow-up message. So this is what it looks like after Liz has gotten her flu shot. We send a message that says, we want to check up on you. Are you experiencing any soreness, fever, or other symptoms? Reply yes or no. So in this case, Liz replies yes. She is in pain and she needs some assistance. So the system lets her know, we've notified your care team and they will contact you within 24 hours. Of course, if you feel it's an emergency, please dial 911. And this just gets written back, you know, to the EHR to alert the team that, hey, we've got a patient that, you know, came in for a flu shot. She's experiencing some symptoms and someone needs to follow up with her. So seamless transition to personal outreach. One really cool thing about the HouseCalls Pro system is we can start, with an automated workflow, and then at any time, the clinic can reach out to the patient via our live chat portal and have a custom conversation with them. So, in this case, the clinic staff saw the reply from Liz saying, yes, I'm having some pain and I need some assistance. So a clinician actually hops into the live chat portal here in HouseCalls Pro, which is also embeddable inside of Epic as another option. But they hop in there, pull up Liz's account, and start to communicate with her directly via text message, asking her, hey, what's going on? How are you feeling? She explains, what's going on to the clinician, and they say, okay, let's go ahead and get you set up for an appointment. When would you be available? So again, this is all happening via text message, right? And at any time, if the patient's struggling, with the text message format or whatever it may be, we can invite them to call the clinic, or even from this live chat conversation, the clinician can say, hey, you know what? We're having a little trouble communicating here. Let me just give you a quick call on your phone and switch it over to that. And that's the walkthrough of the wellness campaign. So as you can see, again, from the clinic side, it really just comes down to a matter of you pulling the correct data and delivering it to HouseCalls Pro. And then from there, the system takes over and runs the patient through the system, schedules them the appointment, offers the different communication methods to make sure that we get it done, and in the end provides a nice seamless experience for the patient. And then Starla, I'm going to pass it back to you if you have any additional information that you want to add, and then I think from there we can take some questions.
Absolutely. So one of the greatest things that comes with HouseCalls Pro is the ability to send out campaigns for all of these wellness opportunities. Looking at the upcoming quality metrics coming down the pike for 2022, we just listed some of them here that we can help to support. So things like site-specific cancer screenings, for breast cancer, colorectal cancer, smoking cessation, the big hitters like diabetes prevention and depression screening. We can also assist with some of the pediatric campaigns, ensuring that our kiddos are staying on their well care tracks. So as long as we can get the data out of Epic, sky is the limit. So good data in allows us to pull the good data out. And this is just a very small sampling of some of those campaigns that we support, and in moving some of those quality initiatives through our communities. So I'm very excited to partner and to move some of these things forward.